Hello and welcome to another insightful episode of MedSynapse podcast series, where we bring you the latest insights and developments in healthcare. Today, we are diving into the fascinating world of hair loss treatments. Hair loss is an issue that impacts millions, and the advancements in dermatology are truly revolutionary. And today, we are privileged to have with us Dr. Abhishek Pilani, a renowned dermatologist and a dermatosurgeon with over a decade of experience, specializing in aesthetic dermatology. He is the founder of Assure Hair and Skin Clinic in Mumbai. Dr. Abhishek's impeccable skills have earned him a gold medal, and he's widely known for his flawless record in hair transplant. And today, he's here to share his knowledge on the evolving landscape of hair loss treatments. So, welcome, Dr. Abhishek.
Hi, Dwi. Thank you for the introduction. It's pleasure being here. You can let me know what needs to be said.
Thank you. So now let's start, doctor. So, do you know what are the most common underlying causes of hair loss that dermatologists encounter these days? And, when it comes to complex cases, how do you approach differential diagnosis?
So basically, first is to differentiate what is hair fall, what is hair loss, what is baldness. There are three different things. Hair fall, to give a basic information, for every individual, 50 to 100 fall in a day is normal. So that is a normal process of hair which goes in a growth cycle and a fall cycle, which is normal with every individual. Hair loss is something when people start experiencing excessive hair loss, more than 50 to 100, and the growth cycle, that is the anagen phase of your hair, is reduced, and the telogen, which is the resting phase, is exaggerated. So then excessive hair loss, and then comes baldness, which is actual hair thinning, where hair miniaturization sets in because of majorly because of hormonal things. Now there can be multiple factors for a male or a female person experiencing hair loss, baldness, thinning, and whatever. Multiple, majorly it is hormonal, so it's known as androgenetic alopecia, male pattern baldness, and male pattern baldness in female known as female pattern hair loss. That's the most common one. There are other conditions which may cause, but a lot of aggravating factors are there. It can be related to stress, heredity, hormonals. In female, it can be postpartum because of thyroid issues, because of PCOD. In men, there can be aggravating. People have this mind of aggravating factors like change in environment, water, and food habits, nutrition, lifestyle, sleep habits. Everything plays an aggravating factor. But major reason in a male pattern baldness or a female pattern hair loss is more testosterone to more dihydrotestosterone formation, which attaches to the hair follicle, causes the shrinkage and hair miniaturization, which leads to it.
So it's like different factors play interplay, and then it affects the hair loss.
Multiple major reason, primary reason is the hormones. Multiple aggravating factors to change the hormonal balance in your body can be there, which leads to the final male pattern baldness.
Okay. So, do you find that certain age groups or patients are more prone to it, especially these days we see younger generation getting it more?
So that's what previously we used to see male pattern baldness or a female pattern mostly in their 30s, late 30s, 40s. But now we started seeing them in early 20s also. There can be two major reasons. Is one, because of the environmental condition and the lifestyle habits what people have, including the sleep, diet, and everything, and the stress. And second, there is a lot of more awareness also that people are concerned about it. So people also are aware about the process, that there are solutions, there are different options available accordingly. So yeah, both these factors have started young people to show up to the clinic very frequently, and they've started experiencing also more.
Yeah, makes sense now. So, now one of the popular therapies these days is platelet-rich plasma, or commonly known as the PRP therapy. So, could you walk us through its mechanism of action, and also, based on recent studies, how effective is it in treating hair loss?
Sure. So let me, I don't know, Hiti, what is the audience will be looking, but I'll just brief about the treatment for hair in a very simple summarized form. So for hair, there are three different category of treatments. What I always advise is one is medical, second is these therapies, which includes PRPs, platelet-rich plasma, one of the safest options. Alternative to that is rollers, mesotherapy, stem cells, growth factors, laser light, multiple options. And third is transplant. Medical therapy, medicine wise, it is very specific. That is finasteride, dutasteride, those are DHT blockers, and minoxidil, that's a topical application, as well as oral tablet at a lower dose helps in vasodilation. So these are specific medicine. Now, medicine given for any kind of hair condition will help you in controlling the hair loss, hair thinning, and delaying the process of deterioration, but it doesn't help in regrowth. Plus, it's a lifelong obligation with calculated added side effects, very less percentage, but that is always there. So we always have to be very sure by evaluating a patient what kind of patient it is, whether it's going to be a regular patient who's going to take medicines properly, and these medicines shouldn't be prescribed over the counter. It has to be with the doctor's consent and the information given to the patient with all possible of things which has to be noticed and need to be continued or not. And second thing is therapies, PRP, as you wanted me to speak about it. PRP is platelet-rich plasma, where we take your blood around 8 to 10 ml. There are PRP, FDA PRP kits, which helps us to separate high concentrated platelets from your own blood. This serum, platelet-rich plasma, the serum will have a lot of growth factors, a lot of cytokines, PDGF, that's platelet-derived growth factor, vascular endothelial growth factor. All these factors and cytokines, all they help is increase the nutrition oxygen to the hair follicle when they injected at the site of hair thinning, which helps in giving more support to your existing hair and increases the anagen phase of your hair cycle. So that is how it helps. Again, this also will not help in regrowth. Similarly, other therapies are also on the similar lines. Like laser light therapy emits laser at somewhere around 620, 630 nanometers. Again, increases nutrition, oxygen, all these to hair follicles and just gives some kind of support. So I always say all these treatments are specifically as an adjuvant line of treatment to your hair, along with medicines or along with transplant for your existing hair, improving quality, texture, or someone who is experiencing a telogen phase of hair fall, that is because of any kind of stress in last 6 months, 8 months, there will be an excessive phase, short cycle for hair fall. So here these treatments work well. Study wise, purely to be frank enough, there are very few studies where a particular single therapy study has been done. It is always combined with minoxidil, finasteride, dutasteride. So all these studies won't hold that kind of validation if I have to justify. But as an experience, yeah, PRP works well in a young patient. PRP works well, helps in faster healing, sustaining the telogen phase, stabilizing it. Last is transplant. Transplant also, I'll brief. It's a very large topic, but I can brief for a layman how it can be explained and it can be given. So transplant, hair transplant, it's a two. It's majorly it's a redistribution procedure that has to be understood. Very importantly, people shouldn't feel that we are creating something new. It is just redistribution. Transplant across the globe, actually, it is categorized into under two categories: FUT and FUE. That's follicular unit transplant and follicular unit extraction. Then there are different names given by different institute. So I'll just go with the books what it is: FUT and FUE. And in both the process, there are two steps. One is extraction, that is, we extract the follicles from the safe zone, and one is implantation, where we implant the follicles at the required site. FUT is follicular unit transplant. It stands for follicular unit transplant. It is a strip technique, where a strip of skin was excised from the donor area. That's the back of your scalp, known as the safe zone, because these follicles are devoid of DHT receptors, so it's known as the safe zone. the safe zone. So this strip is excised, the follicles are extracted and used for implantation. There are multiple cons of this procedure. Majorly restricted, there's an aesthetically not acceptable scar. There might be persistent headache. There'll be restricted number of follicles because a particular area is extracted. Multiple sessions cannot be done. And so to avoid all these, majorly it is not practiced nowadays. Mostly people don't prefer doing FUT. Uh, Second option comes as FUE, that's follicular unit extraction. So follicular unit extraction again, two parts. First is extraction, second is implantation. Here, we are not giving you any kind of cut, stitch, or anything. So, hypothetically, these are your hair follicles. There's a motorized machine with a punch, goes, cuts the internal attachment of a muscle and a gland, and we take out the follicle one by one randomly. Here, the aesthetically, the best part is whatever size of punch we are using in a proper way, in a proper direction, not transecting the root. It helps you to give a aesthetically very good, much more acceptable results, not damaging the donor area, not causing any kind of scarring. Once these follicles are extracted, these follicles are implanted in the front center crown area wherever there is hair thinning or baldness setting. And the growth phase, this entire procedure, once the procedure is done, the growth is seen in 6 to 8 months. If it's taken from the safe zone, I believe at least for next 15-20 years, it shouldn't require any kind of maintenance.
Oh, it's so impressive to know, especially, I was very intrigued by the term where you mentioned that it does not really help with hair, gaining your hair back. So it was very interesting for me because these days in the market also we see there's so much of hair growth serums or hair oil that they've been selling. So it's very interesting.
So any hair oil, so whatever people market, anti-hair fall shampoos, anti-hair fall oils, or anything, there is no oil or shampoo which will actually help you in gaining new hair. It may just help you in nourishing, cleansing your scalp, having a moisturizing effect. That's it, nothing more than that.
Oh, interesting. Now, speaking of treatments, also some medications like you earlier mentioned, like finasteride or minoxidil. So these have been long used in treating androgenic alopecia. So can you share your thoughts on how they work, and are there any new pharmacological developments on the horizon that healthcare professionals should know about?
So basically, minoxidil, it's a potassium channel opener. It's a vasodilator. It was used initially only as a topical format to increase blood circulation. Again, improving oxygen nutrition to the hair follicle. We've started giving that in oral doses also, lesser dosage. Uh, we should be very attentive in knowing any kind of blood pressure history in the family. It may cause hypotension when taken orally at a higher dose, and it just continues to help in supplying the nutrition oxygen till the time you apply it. Also, people who start applying minoxidil should be well aware that initial 2 to 3 months will be a excessive cycle of hair fall, which is just a stabilizing cycle and stabilizes after 45 to 60 days. But it needs to be continued on a regular basis for a very long period. We normally say lifelong. Similarly, finasteride, dutasteride, medicines are good. They are FDA approved. So these finasteride was discovered as in a very acceptable side effect for something else. So finasteride was a medicine which was used to treat benign prostatic hyperplasia, where people taking those medicines under trial could see a lot of control in their hair fall. And that is how this was discovered, which is given at a lower dose of around 1 mg at a day finasteride. But it may still have less than 2% chances of some kind of side effects like post-finasteride syndrome, erectile dysfunction, impotency, nervousness, stress, depression, psychosis. All these side effects are well reported. There was a case in USA where Propecia, brand name for finasteride, had to face a legal lawsuit, and it just got after thousands of claims, it got settled last year with 4.3 million settlement amount kind of thing. After that, it was very much necessary that there's a leaflet with the medicine which is mentioning all these side effects. The only problem over here is one, in India specifically, available of the drugs over the counter, where people will just read on Google or internet and find out that this is a medicine for hair fall and just take it as per they are, without evaluating, without visiting a doctor. And that's a major concern. The doctors prescribing should evaluate the patient properly before prescribing these medicines. Second problem is even the side effects are easily readable on internet. So when you know that this is the kind of side effects you may experience by taking a medicine, most of them have a placebo effect where they feel that they've started experiencing the side effect and discontinue the medicine abruptly. So these two things are a shortfall. You need to evaluate, consult a patient, explain him in detail. It is not that dangerous or harmful or having that kind of, but you need to have an understanding of the patient and prescribe the medicines accordingly.
That is really insightful, and actually it's rightly mentioned by you that the people usually go on Google and search these days. Now, personalization seems to be key in most aspects of modern medicine these days. So, how do you approach personalized treatment plans for hair loss, especially considering genetic predispositions and lifestyle factors that may influence these outcomes?
So as I mentioned, it be that as per the stage of baldness, thinning, hair fall, if it is just a normal over hypochondriac patient considering 50, 40, 50 hair fall in a day is stress, just a normal counseling may help him or her. Second thing is if there is required where they've started experiencing more hair fall and it is still very healthy, maybe PRP as a safe option. I may start evaluate for any kind of other deficiencies, nutritional deficiencies, any kind of lifestyle modifications required, sleep, diet, everything. And if there is baldness which is set in, even in a young patient, hypothetically front area is the hairline is receded, the crown is receded, something like that, will advise for a transplant because 20 to 35 age group is what I feel these people are developing their personality, and any kind of such restrictions will not allow them to develop. So yeah, this is how I would approach a patient.
That is interesting. So, do you encounter that patients are becoming more proactive about lifestyle modifications once they understand how it can impact their hair health?
Not really. If hair was the only way where they could have modified, but yeah, what I've encountered is post transplant for sure. So there are a lot of patients, young patients, but very dull, obese, not that much interested, very introvert kind of personalities having transplants done. I have a lot of stories where they've done a transplant, they started looking good, they started feeling good, and I've had huge transformations, started working out. Some were not so much presentable because of hair. They never thought about their body also and had a very dull lifestyle. Have changed and now entered into modeling also. So these kind of stories are always there because something motivates you, something which when you look yourself in mirror and you feel good about it, you start taking care. So that has happened. But just by my counseling that if you improve your lifestyle and if you don't do this and that, you'll save your hair. I've not seen any kind of improvement.
That is true. Now, hair loss can also have a profound psychological impact. So, what are some psychological factors that healthcare professionals should consider when treating their patients with hair loss, and how can we best support them emotionally during this treatment?
Very simple. It is all the phases at present. Science has advanced so much, so all these phases have uh, solutions to it. So there's nothing we need to stress about for anyone. Accordingly, whatever stage you are, consult a dermat, get yourself treated accordingly, and it is simple. It is finally end of the day, it's an aesthetic thing, which is now correctable with the advancements. So I don't think you should stress about it, specifically the healthcare professionals.
Yeah, that is
They have other
rightly
stresses
mentioned.
otherwise also.
True. Now, finally, looking ahead, what emerging trends or technologies do you foresee transforming hair loss treatment in the next few years?
There are multiple things which are happening, but maybe mostly are not yet got an FDA approval, or long-term effects, side effects are still yet to be ordered. So there are stem cells therapies, there is exosomal therapy, which is already there in the market. People are doing it. I don't know how legit they are. Most interesting would be a hair cloning therapy, where major restriction in a transplant comes to when the donor is very poor and there is no donor and the area to be covered is very huge. So as I mentioned, it's a redistribution. We may take it from beard, body, and etc. also, but still it's not sufficient. We may not be able to cover the scalp, and we have to compromise on the density and stuff. Hair cloning is something where we take stem cells from the donor hair follicle self in a specific environment. It is cultivated and multiplied into millions and injected on the scalp, which may take away this only restriction of the donor area, and not damaging the donor area neither, and also having a head flourish. So this is something what can be expected over next 5 to 10 years. Eventually, in actual practice, when we understand whether there is no long-term side effects, or how it's working, how much is it sustainable, kind of thing. So that is what I guess should be the next thing.
Oh, so it sounds like pretty exciting to me. So, thank you so much, Dr. Abhishek, for sharing your expertise with us today. But before we wrap up, one last question that I would like to ask is, what inspired you to pursue dermatology particularly in the area of hair restoration?
So my dermat seat was a cancellation seat which I got randomly. I was never inclined towards it, to be frank enough. I was intending to do something in plastic surgery, but my rank didn't allow me. I had taken a drop after MBBS. Luckily, I got a cancellation seat in dermat. In dermat, being towards inclined towards the surgical field, hair was the only option majorly in India to practice. So that is what motivated, and then started attending few specific case specific seniors conferences, attended few workshops were there, and immediately after I passed out, my first job was as an hair transplant surgeon, where I was trained also, and I could see a lot of transformations. So that is which made me decide, yeah, this is a field. But majorly, the ethics in this industry, specifically in hair transplant industry and aesthetic industry in our field, is very poor. Where hair transplant is not practiced by doctors. It's a time consuming, tedious procedure. The guidelines itself allows paramedical staff to do the procedure, which was not in sync with my thing. So that's the reason I started my clinic, and I still did perform transplants on individuals who are my specific for me, day in and day out. So this is what I do.
Really impressive, I would say. Thank you for sharing that with us. And now that brings us to the end of today's interview. And a huge thank you to Dr. Abhishek for sharing his valuable insights with us.
It was a pleasure talking it. Thank you for having me on board.
Thank you. And I hope our audience
Thank
found this discussion both informative and inspiring. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, take care.